Media WA.
My name's Bram. I'm a 35-year-old man. I live in Perth, Western Australia. On the 13th of November 2021, I was clinically diagnosed with myopericarditis as a direct result of the vaccine I had on the 6th of October, the Pfizer mRNA vaccine. Acute myopericarditis, second to Pfizer vaccination. This is the Royal Perth Hospital discharge summary. Dated 16th of November, I presented 13th of November. I was in hospital for 4 days. I've had numerous tests. My story is clear evidence of a pattern of hiding the data. I now have a serious heart injury with no known long-term outcomes. I'm a family man. I've got a 5-month-old daughter and a beautiful partner. I'm worried about what is going to happen to me in the future. The injection was on October the 6th. The diagnosis was made on the 13th of November, following multiple presentations with chest pain to 2 different GPs and the ED prior to my diagnosis. On the 28th of October, I presented to Royal Perth ED with this chest pain. I was told my heart was perfectly healthy and discharged. On the 26th of October, I presented to a GP in Vic Park and was told I had a mountain biking injury, a muscle strain. On the 1st of November, I presented to another GP in Spearwood and was told that my symptoms could be either anxiety or indigestion. This is the script he wrote for my indigestion medication that he told me would fix my heart pain, and told me that if my symptoms resolve in 2 weeks, it will be because of the indigestion. My symptoms did not resolve. On the 13th of November 2021, I had the most severe sharp chest pains I'd had out of all the time leading up to it. I went to Royal Perth ED where I was diagnosed with myopericarditis. I had a raised elevated troponin, which is a marker in your blood that indicates heart cell death. I had multiple irregularities on my ECG trace, which is the graph of your heartbeat. I had multiple tests done, ED, before they transferred me upstairs to the cardiology ward, right before the handover. The doctor that had been treating me up until that point, a nice Irish doctor, said to me that he had been vaccinated. All health workers have to be vaccinated, and he thankfully had no reaction. But if he had have known how many people were going to come through ED with the vaccine reactions, he would have never allowed himself to be vaccinated. He told me that. I might be paraphrasing, but that's what he told me. I have verbal and written documentation that shows my severe heart injury as a result of the vaccine that I had prior. I have not been told what my long-term prognosis is, what my long-term health implications are if I'm at higher risk of heart disease or heart failure. They have not told me how long it's going to take to recover, other than broad generalities. They do not know at this stage what the vaccine-related myopericarditis, what the long-term health is, because it's such a new vaccine. This is my discharge summary from Royal Perth Hospital Cardio Ward. It clearly states principal diagnosis, acute myopericarditis, second to Pfizer vaccination. And there's a whole heap more data, both sides, front and back. This is a letter from my doctor. It's a vaccination exemption, a temporary vaccination exemption. It reads, "To whom it may concern an employer, this is to confirm that Bram has had a significant reaction to an mRNA vaccine, brackets Pfizer, resulting in myopericarditis. I advocate a temporary exemption from any further COVID-19 vaccination for 6 months or until symptoms have resolved, whichever is shorter, from the 13th of November 2021. Gives me 3 weeks away from work, possibly more depending on how my recovery goes. It says here pericarditis, although the clinical diagnosis is myopericarditis. I believe the multiple presentations prior to my clinical diagnosis point to a pattern of avoiding diagnosing these these symptoms and these conditions following the vaccination. I had no prior health issues prior to the vaccine. I now have a serious heart injury with no known long-term outcomes. I'm a family man. I've got a 5-month-old daughter and a beautiful partner. I'm worried about what is going to happen to me in the future, and if I want to have a heart attack when I'm 40. I don't know. No one knows. Having a vaccine like the mRNA is like playing Russian roulette. You do not know what you're going to get. Some people are fine, some people seriously sick, some are dead. I want people to seriously think about getting injected because I don't think it's safe. Clearly what happened to me, I'm worse off than I was before the injection. I've got a serious heart condition. I want people that have been unfortunate enough to be vaccinated and now have these problems, I want them to make sure they do their own reports, their own WA VSS if you're in Western Australia, your own TGA adverse event. It's important for those unlucky enough to have side effects, that these side effects are properly documented, and the only way you're going to ensure that is if you make sure that you do the report yourself. As proven by my repeated presentations, you cannot rely on the doctors to make these reports on your behalf. They are getting buried unless it is so severe that you're laying in a hospital bed for 4 days. I'm doing this not only for my story to get out there, I'm doing this because I do not want similar things to happen to her or people her age, children, adolescents, school kids. I do not want people to be in the same boat that I am.
Brought to you by Freedom Media WA. Like, share and subscribe to my channel to see real people telling real stories.